is Haley McKee. I'm a person in long-term recovery. Here on behalf of myself and on behalf of RICARES, the Community Recovery Organization for Rhode Island. I'm going to share a little bit of my story of addiction, my ongoing process of recovery, and I'm also going to talk about fentanyl strips. In November of 2006, I was violently assaulted in my home. For the majority of a full hour, I had someone sit with his full weight on my chest, while one of his hands covered my mouth, his other hand covered my nose. While I struggled to free myself from a person who was trying to kill me, I incurred other injuries, such as the one that left a perfect impression of the back of my head on the refrigerator. I was bruised and bleeding from head to toe when I received medical care. The first script alleviated some of the physical pain and also numbed the heavier stuff, which was the trauma. I got home and took an inventory of the damage that surrounded me. I compulsively started patching holes in my walls and cabinets, stripping the wallpaper, sanding and refinishing all of my floors because I couldn't live in the space after what had happened. About a week into this project, I caught pneumonia from breathing in horsehair plaster, and once again I'm walking out of a doctor's office, this time with a prescription for codeine cough syrup. Now I'm hurt and sick, so I call a recommended painter to help me finish sanding. He tells me that he sells Vicodin. Despite my being in my late 20s and always having turned down drugs, never ever taking them, I buy pills. Because unbeknownst to me, I'm already addicted. Within a week and a half of being issued that first script, I have a drug dealer. What would follow is a few very long years of complete dependency to opiates and some very bad choices. While I'm not going to dwell on the mess because I do think that this should be more about the message, I will sum this up by saying that I created pure chaos for my friends and family. During a period where I was able to abstain, I was involved in something tragic. I then started using heroin, and I went to prison. It was during my incarceration that I had the good fortune of meeting Michelle Carter. She is a peer recovery coach who was a director at Anchor at the time. At this point, I was a shell of a person, devoid of feelings, coming off months of detox, raw and empty. And I remember feeling just how puzzled I was listening to this woman who was vivacious, she was intelligent, she had a purpose, and she understood where I was coming from, really understood. We would meet regularly and work through a woman's guide to recovery. She would tell me things about myself that were hard to hear, and as much as I didn't want to listen, I absolutely needed to. While I was initially resistant, I eventually did. And this was the beginning of my recovery. The peer relationship dynamic had a profound effect on me. I started to process all of the things that happened to me, the things that I had done, and I also began to deal with some of the shame of drug addiction. This led to one epiphany after another, and I soon began to think about how I wanted to live my life when I got home, which I eventually did. My parents were gracious enough to provide a safe space and open the home to me while I got my bearings and adjusted to my new life of sobriety. I was able to find a job due to employers that were willing to look past an ankle bracelet and gave me an opportunity to work for them. My home confinement officer saw potential and urged me to go to college. My dad echoed this and told me that I should try a psychology class. A college professor working at CCRI, Barry O'Connor, told me that I was smart enough to be there when I didn't feel the same and helped me navigate the process of being human. I graduated with my associate's degree and I currently attend BRIC, where I'm working towards 2 bachelor's degrees in psychology and also chemical dependency and addiction studies degree. When I graduate next year, I plan to immediately pursue a PhD in clinical psychology and will help people like me overcome this disease because it's not only dangerous and awful to those afflicted, it is also very detrimental to those around me. Today I get straight A's, I pay taxes, and I work hard. What was undone in one horrible hour of my life took years and a village to put me back together. I was lucky in getting connected with the best recovery coach in the state, having a loving and supportive family and housing, employment, good relationships, and education. This is my recovery capital. All of these things collectively are what is needed to help a person recover from drug addiction. There's one more piece to this that weighs on me very heavily. It'll be 5 years next month since I've taken opiates. In this time, the loss of life from this disease has skyrocketed from the increasing presence of fentanyl and drugs. I would like to dispel a common belief about drug addiction. I like drugs less now than before I was in active addiction, but I loathed them as I was using them. Absolutely loathed them. There were a couple of occasions when I woke up underwater in my bathtub. I have overdosed. I have also had nights where a friend was called over because I was sure that I had taken too much heroin. And I needed someone to watch over me to make sure that my breathing didn't stop. There was a definite fear of death when I was in active addiction. I can empathize with the people that are living and struggling with this today, because these fears are now much more substantiated. I feel as though I just narrowly dodged a bullet due to the fact that the opiates that I used were exponentially less dangerous than the substances that are currently circulating. Elements of harm reduction, such as clean needles and naloxone, have been absolutely imperative in response to this epidemic. Fentanyl strips would certainly save lives as well. There are consumer labels available to almost everything that we put in our bodies, from the saturated fat and content in foods to the percentage of alcohol and liquors. A substance that leads to the loss of tens of thousands of deaths every year should be no exception. This is a public health emergency, and people who are living with this disease should have any and all resources that are available to protect themselves from fatal overdose. Fentanyl is emerging in other substances as well. Rhode Island is one of the only states that has seen a reduction in overdose deaths, despite both the presence and potency of fentanyl in substances becoming more of a threat to public safety. This is due to massive efforts by law enforcement, the medical and recovery community. I believe that fentanyl test strips will be a life-saving asset that is a part of the evolution and adaptation to this public health crisis that will help facilitate each and every individual's pathways to recovery.